All right. Hello and welcome, everybody. Come on in and get comfy. My name is Brittany. Most folks call me Smash, and I am the Community and Congregational Relations Coordinator here at the Night Ministry. Throughout the next couple of weeks, we will be hosting a series of Facebook Live question and answer sessions. And today we are beginning our series with a discussion on racial inequity and how it pertains to homelessness and poverty. We're honored to have as our very special guest Dr. Omar McRoberts, who is an associate professor in the Department of Sociology at the University of Chicago. Dr. McRoberts' scholarly and teaching interests include the sociology of religion, urban sociology, urban poverty, race, and collective action. He is currently conducting a study of Black religious responses to and influences on social welfare policy since the New Deal, culminating with George W. Bush's Office of Faith-Based and Community Initiatives. He is also initiating an ethnographic project on cultures of death and dying among Black congregations in low-income urban contexts. We are glad to have an expert with us. Thank you so much for joining us today, Dr. McRoberts.
Thank you. Thanks so much for having me.
So for everyone out there who is watching along with us, we invite you to type any questions that you may have either for Dr. McRoberts or myself in the comment section, and we'll try our best to answer. We have a short time today, so we'll see if we can get to them. And we have prepared a few questions, and we're just going to jump right in. So here at the Night Ministry, we know that nationally, Black Americans are 3 times as likely to experience homelessness as compared to our non-Black population, and that Black Americans are more than twice as likely to be living in poverty as compared to white Americans. Specifically here in Chicago, more than 60% of those experiencing homelessness are Black, even though African Americans make up about 1/3 of our city population. So Dr. McRoberts, can you tell us a bit about why these numbers are so disproportionate?
First, I would note that poverty is probably the major cause of homelessness. People become homeless for all sorts of reasons, but the condition of homelessness is most often connected to the condition of poverty, even when there are other conditions present. And African Americans are far more likely to be poor. 1 in 5, something like 27.4% of Black people in the United States live in poverty, which is more than twice the rate of white people at just under 10%. Why are Black folks disproportionately poor? We could start with lack of jobs, poor educational opportunity, the legacy of slavery and discrimination have also made Black people more economically vulnerable. And it's not just poverty, but it's concentrated poverty, spatially concentrated poverty, geographically concentrated poverty. African Americans are more likely than any other group to live in areas where there's high poverty, right? Concentrated poverty. And these are places where there are very few economic opportunities, few services, often very poor educational opportunities, right, in communities, right? And there's also deep intergenerational poverty, right? Families that are poor generation after generation after generation, who live often in the same communities that lack these crucial resources. And people who become homeless often have lived in these very poor neighborhoods immediately before becoming homeless.
Thank you. You mentioned the legacy of slavery. I'm wondering if you could talk to us a bit more about the historical factors that have led to these inequities and these communities of concentrated poverty.
Basically, African Americans, we could say the legacy of slavery, we've never really recovered from the condition of slavery. Immediately after slavery, you have the legacy of Jim Crow, very intense legalized discrimination in the South and actually elsewhere, which sort of forcibly held folks into positions of disadvantage, right? There was never any sort of access to resources that would allow people to begin to generate wealth for themselves. The promise of the 40 acres and the mule after slavery never arrived, but it would have taken something like that in order for African Americans to begin to elevate economically and otherwise. And so when we think about the impact of slavery, the legacy of slavery, what you realize is that we're not talking about African Americans falling from a position of privilege or access or attainment. It's the fact that African Americans have never actually had the adequate chance to emerge from the great deprivation of slavery.
Thank you. I'm wondering how these pockets of concentrated poverty for African Americans relate to home ownership. We know that Black home ownership is at 42%, which is remarkably low compared to 72% of white folks who own homes. Can you tell us a little bit about government mandated policies and how they've led to racial inequality in the housing market?
Yeah. Well, historically, after around the time of the Great Depression, when we see the first federal or nationwide government housing policies, we find that these policies really did intentionally favor white middle class families and deliberately neglected people of color. The federal government tried to stabilize financial conditions for home ownership by, for example, establishing the Homeowners Loan Corporation, the Federal Housing Administration, and also a secondary mortgage market. And all of this provided publicly backed, low down payment, long-term, fixed rate home mortgage loans for people, which was intended to increase the demand for housing and to boost the construction and lending industries. At the same time, the federal government also establishes the Public Works Administration, the housing division programs of the Public Works Administration. And that sponsored public housing construction, slum clearance, and so on in the inner cities, ostensibly to improve conditions of low-income families and boost employment in the building trades. But all of this government activity around the time of the Great Depression actually began to increase racial segregation and racial inequality in housing. It actually targeted middle-class whites for the mortgage opportunities and would eventually encourage suburbanization as well, which we find increased concentrated Black poverty in cities like Chicago. The Homeowners Loan Corporation in particular established redlining, right, as a way to evaluate the quality of neighborhoods based on racial and ethnic makeup mainly. So African American neighborhoods would receive low ratings and were subsequently classified as too risky to receive government-backed mortgages. Investments were deflected away from central cities where African Americans at this point in history were primarily concentrated. And we know that the practice of redlining persists in a number of forms in loan markets to this day. Meanwhile, the slum clearance projects in the inner cities start to displace poor Black people from areas that happen to be near developing white areas, right? And then public housing eventually becomes a permanent housing solution for those displaced people. Okay, so 1968, you get the Fair Housing Act, which was part of the Civil Rights Act of 1968. And this was the first legislation designed to begin to try to correct the racially biased policies of the previous era. And this was meant to eliminate at least overt discrimination and correct disparities in the housing market and ultimately end residential segregation. It prohibited discrimination in the sale or rent of housing, the finance of housing, and the provision of brokerage services. But the Fair Housing Act did not really have any teeth. There were no provisions in the legislation that would support enforcement of the law. Some enforcement provisions were added in, I believe, 1988, again in 2013, again in 2015, but these even have been insufficient to prevent discrimination in housing markets and lending. And so in spite even of the Fair Housing Act, we find that large racial disparities in housing still exist. And so we have persistent residential segregation and a racially segmented housing market, which have great implications for African Americans' economic mobility and their ability to accumulate wealth through home ownership. Even Black folks who own homes tend to own in racially segregated areas where homes are typically worth less and often do not appreciate at the same pace as those in neighborhoods where white homeowners live.
Thank you. Thank you for pointing out that even as some of these perhaps overt racist policies shift and change, that we are still experiencing a lot of the inequities that spring up because of them. I'm wondering if you could talk to us a little bit more about how these racist and discriminatory government policies, particularly in housing, how they've trickled into the practices of perhaps independent entities, communities, other organizations. How have they trickled in?
Oh, well, I think the biggest example is the practice of redlining itself, right? Which again begins as part of federal policy in mortgage lending, but then becomes a part of privatized banking and loan making more generally. And so redlining is, we think now of redlining often as something that private banks engage in, a sort of discriminatory racialized practice of undervaluing and denying credit to folks in poor and African American communities. But this is something that basically started with government and trickled into the wider private market system.
Thank you. And that's helpful as we continue to wrestle with why our communities continue to remain so segregated. I want to move on and talk a little bit about our criminal justice system. African Americans make up 13% of our general population in the United States, but account for 40% of the prison population. We know that having a conviction on your record makes it harder to find employment and housing. Can you elaborate a bit on the unfair treatment of Black and Brown people in our criminal justice system and how that contributes to homelessness and poverty?
Yes. African Americans are disproportionately involved with the criminal justice system. Blacks are more likely than whites and other groups to be arrested in the first place. Once arrested, Blacks are more likely to be convicted. And once convicted, Blacks are more likely to experience lengthy prison sentences. Now, the first part of this, the arrest, right, the contact with police and the criminal justice system in the first place, clearly connected to policing, which is militarized, racialized, and targeted at African American communities, especially poor ones. And then also, it is tied to a system of mass incarceration that creates a virtual pipeline from poor Black communities to prisons. And these are prisons which are increasingly for-profit corporations. And so there's a profit motive for keeping the prisons full. The war on drugs, as well as policing policies like stop and frisk, the broken windows theory, right? The idea that policing should seize on minor signs of disorder, because minor signs of disorder will cascade into larger manifestations of disorder, right? So arrest the one engaging in a minor, right, infringement or disorder, right? All of these create higher levels of police contact with Black people. And that includes higher levels of police contact with innocent people and higher rates of arrest of folks for drug crimes. But this as well is a historical pattern. It's not entirely new. Racialized policing as we know it begins with the patrols created to chase down and return escaped enslaved Black people. And then after the end of slavery, Jim Crow laws criminalized Black existence in public in ways that began the profitized mass incarceration of Black people, basically returning them to a state of slavery because incarcerated Black people were made to work for free. But then, connecting this back to homelessness, people return from incarceration typically without the resources to build a life. Having a criminal record, as you began to note, Reverend Smash, having a criminal record makes it harder to get jobs where there are often background checks, right? Licensing requirements that tend to screen out people with criminal records. The Welfare Reform Act of 1996 imposed a lifetime denial of cash assistance and food stamps to people convicted in state or federal courts of felony drug offenses. And so people with criminal records are disproportionately poor. And poverty, in turn, is one of the major conditions leading to homelessness. Having a criminal record also can make it hard to get affordable, safe housing in the first place.
Yeah, thank you for pulling all of those things together for us. I want to maybe pull in one more topic. At the Night Ministry, we provide free and accessible healthcare to folks. And I want to kind of pull together incarceration and mental health care and homelessness. The Cook County Department of Corrections lists itself as the largest mental health institution in our nation. And we know that many people experiencing homelessness have mental health difficulties and don't have access to mental health care. How are incarceration and mental health related? And what does all of this have to do with homelessness?
Okay. Well, I'll start by saying a little something about African Americans and healthcare in general. Black folks suffer poorer health outcomes across a whole host of conditions. Black Americans die on average at a younger age than white Americans. And we suffer higher rates of death from a string of diseases, including heart disease, stroke, cancer, asthma, diabetes. The Black infant mortality rate That's babies who die before their first birthday is more than 2 times higher than that for whites, right? Something like 11 deaths per 1,000 live births for blacks as compared to just under 5% for whites. We can think about the COVID crisis that we're in the middle of. This has impacted African Americans disproportionately as well. And it's not because Black people won't wear masks or insist on taking spring break in Florida. It's because African Americans have less access to quality health care and are more likely to have the underlying health conditions that makes COVID deadly. And that's partly because of insurance, right? Lack of access to insurance, lack of adequate insurance, but it's also sometimes geographic isolation from good health care. And it's sometimes poor housing conditions. People are catching COVID in their homes, right? When there's overcrowding and when you have intergenerational households, which will expose the most vulnerable people, which are older people, to less vulnerable people who happen to be carriers. And so even though African Americans are dying at a rate of something like 92 people per 100,000 patients admitted to the hospital were most likely to be white, and they die at a rate of 45% per 100,000. I mentioned lack of access to adequate health care. A lot of this is about that. Poor people and Blacks in particular have less reliable access to health care, including mental health care. And Blacks are far more likely than others to not have health insurance or have, maybe they have inadequate health insurance for their medical needs. Most of the people in the United States who do not have health insurance are people of color. And there's also active discrimination in the healthcare system, right? Where Black people are less likely to receive treatment for medical conditions and less likely to receive appropriate referrals for medical conditions. Diabetes, for example. African Americans have some of the highest rates of diabetes, but are less likely to be referred to dietetic services to help them control blood sugar through diet and so on. And so Blacks are more likely to lose their sight or kidney function from diabetes, right? Sometimes the lack of referrals is tied to the lack of insurance, but it's also discrimination. But when, to your point, when Cook County says that it's the major provider of mental health care, they do not mean that they're really providing mental health care. It means they are handling more people with mental health challenges than any other institution, right? The police and the jails are not providing mental health care. They're interacting, often inadequately, with lots of people with mental health issues in the absence of adequate care. People with mental health challenges are becoming criminalized in the absence of adequate care. People with mental health issues are becoming criminalized when no other system is available to treat them. And people who have serious mental health issues are especially vulnerable to becoming homeless. But also with all kinds of serious medical conditions, right? People are vulnerable to becoming homeless when the expense or the debilitating nature of their illness contributes to their poverty. And that takes it back around to poverty as the major condition leading to homelessness.
Thank you. Thanks for tying that together so that we can see how systemic racism leads to inadequate healthcare in general and also mental health care. We see that there are a multitude of entities trying to address homelessness. There are social service agencies, there are government programs, there are organizations like ours here at the Night Ministry. But homelessness continues to be a widespread problem, and as we've talked about today, particularly so in Black communities. I'm wondering if you can tell us kind of what you think in terms of combating homelessness, what is helpful and what continues to perpetuate systemic inequities?
I think, as we think about all of the different types of organizations, folks doing wonderful work like the Night Ministry, trying to end homelessness, we have to understand that ending homelessness means ending racial inequality in multiple systems. You can't separate the problem of homelessness from the problem of institutional racism and deep-seated racial inequality. And I say in multiple systems, and it's all of the systems that you've asked questions about today. It means ending housing discrimination and inequality in access to safe housing. But that means, for example, fully enforcing the Fair Housing Act of 1968, right, at all levels of government. The Trump administration, through Ben Carson, who's the head of HUD, Housing and Urban Office of Housing and Urban Development, has actually been rolling back the enforcement of fair housing policies and diluting the Fair Housing Act. At an institutional level, finding teeth for that institution, for that law, would be a tremendous start. Healthcare, including mental health, needs to be expanded. Access for healthcare needs to be expanded for poor people and people in poor communities in a way that particularly mental health issues should not need to be criminalized, right? The way that they are now, where you end up with the police and the criminal justice system being able to call themselves the biggest purveyor of mental health care. It should be healthcare professionals who do that, right? So there's a systemic expansion that needs to happen, and a systematic penetration of these services into the places where people need them the most. And obviously, the expense of healthcare as a barrier to that access needs to be removed. The criminal justice system. This means ending war on drugs era policies and styles of policing. 3 strikes, stop and frisk, eliminating the for-profit prisons and the militarized, racialized, racially targeted policing and increasing services for prisoner reentry, right? Removing the barriers for ex-offenders who come out and again find themselves without any resources to really build a life and find themselves in poverty. And if not recidivizing, right, committing a crime again that will land them back in the criminal justice system, finding work, which means job creation, right? This is large-scale stuff. Job creation, publicly funded job creation, elevating the minimum wage, perhaps instituting a guaranteed minimum income, right? So that people simply do not fall into serious poverty and have the resources that they need to be housed and to survive.
Thank you. It's definitely helpful to hear more about systemic fixes to racial inequality. I know that for many of us, as we begin to learn more about systemic racism and about how it affects kind of all entities in society and how it particularly affects homelessness and poverty, we question, well, what can we do? What can we do as individuals? So can you tell us a little bit about advice you would give people as they're starting to learn more about systemic racism, about systemic poverty? What can people do if they want to respond to that?
Well, the first thing, important thing to understand about systemic racism, which then I think connects to individual responses, is to understand that systemic racism uh, is not so much about individual attitudes about race. Um, right? So, of course, there is personal racism, right? There is attitudinal racism, the kinds of discrimination that occur in interactive settings. Um, that's very real, right? The kind of discrimination and racism that individuals are able to perpetrate on other individuals or groups of individuals, that's real. Um, but systemic racism is bigger, and it's related to the way, I mean, it's called systemic racism because it rests in systems, in institutions, and it does not necessarily rely on individual attitudes and people acting on personal racist dispositions, right? A person who believes that they're not racist at all can be participating in a system, in a structure, right, in an institutional context that is perpetuating racial uh, inequality. Um, and so the most important thing that individuals can do in that regard, aside from, obviously challenging when we do encounter attitudinal racism and discrimination, to obviously, be willing to call that out for what it is. But in addition to that, to begin to understand the way racism is built into these systems, these institutions, right, where it's hard to pinpoint, to put a finger on a face and say this person did it, right? To begin to understand the way that these systems operate and the way that they disproportionately um, disadvantage certain people, African Americans in particular, and to begin to critique and call that out, right? The way that the system actually works. And so, your questions about the various kinds of institutions and systems and the history of that stuff today um, is a beginning. Understanding how racism operates in healthcare, housing, policing, and so on. And then beginning to find ways to challenge, collectively challenge at the institutional level, right, the way that these things work, as well as at the personal, individual level.
Thank you. That's helpful to hear. For those of us who may be interested in learning more about the topics that we've discussed today, is there anywhere you would point us where we could learn more, gather more information so that we can kind of move towards that collective action stage?
Gosh, there are so many resources. The Center for American Progress, for example, has produced a wonderful report on the history of racialized disparities in housing, which is very clear. It's also deep and extensive, quite useful. There are I'm sorry, I'm looking at some of my own resources here.
No, take your time. We appreciate it.
Yeah. There was a report to the United Nations on racial disparities in the U.S. criminal justice system. That's really exemplary. It was published in April of 2018, and I believe that can be found online. Those are two particularly good resources that are at my fingertips that I can recommend.
Wonderful, thank you. I hope that those watching and those who support the work of the Knight Ministry will continue to do some research on their own. I mean, like you mentioned, there are a multitude of resources out there, and even a simple search in Google about redlining or about racism in healthcare, those can turn up lots of results that I think would really help folks out. We're gonna kind of transition to our closing. Dr. McRoberts, thank you so much for joining us today. I think we all learned a lot, and like I said, I hope we all can commit to addressing systemic racism and homelessness. I know that at least myself, I learned a lot, and I want to focus more on these issues. Is there anything that you would like to share with us in closing?
Nothing additional in closing. I'd like to thank you for having me and for organizing this really important discussion. And I want to commend the work of the Knight Ministry.
Thank you so much. We certainly appreciate you being here with us and taking the time to share your day with us. So everyone else, we invite you to like and share this live stream so that others can gain this information as well. And to tune in next week to our next session. Next week, we will have a member of our youth outreach team with us to talk to us about what youth outreach looks like in our current societal context. So thank you for joining in. Be well, stay well, wear your masks, and we will see you all next week. Thanks, Dr. McRoberts.
Thank you.